Hi, my name is Rebecca Adebayo, and I will be discussing the dangers of nicotine. Nicotine is a poisonous, addictive chemical found in tobacco plants and is used in many tobacco products, such as cigarettes, cigars, smokeless tobacco, hookah tobacco, and most e cigarettes. When looking into the history of nicotine, nicotine was first extracted in 1828 by German chemists Wilhelm Heinrich and Carl Ludwig Riemann. The purest form of nicotine is known to be a clear liquid with a strong odor. When exposed to air, the liquid transforms into a shade of brown. Nicotine is a naturally occurring enantiomer that originates from the Nicotiana species, which is a kind of tobacco plant. The plant first originated and is found in South America before spreading to North America, Africa, as well as Australia. Nicotine is known to be one of the most addictive agents, and in 2010 was actually declared just as and if not more addicting than harder drugs such as cocaine and heroin. When looking at the different drug classifications, nicotine actually falls into the stimulant category. 26% of all college students in the United States of America actually smoke nicotine on the daily. So, when looking at nicotine, what exactly does it do for us? Nicotine creates a temporary feeling of well being and relaxation. When smoked, nicotine sends a signal of dopamine to the brain. Nicotine increases our heart rates and the amount of oxygen that our hearts use. So, our bodies absorb nicotine very quickly into the bloodstream, and because of that, it reaches the brain really fast. Due to that, the peak feeling of nicotine is very short lived, and our minds want to consistently feel that feeling and chase it, and that creates a cycle which leads to addiction. So nicotine can be found in various forms. Forms that nicotine can be found in include chewing tobacco, nicotine pouches, nicotine patches, vapor, sniffs, and as mentioned earlier, cigarettes, e-cigarettes, and hookah. Another fun fact is the leading component in cigarettes that make it so addicting is actually nicotine. So, nicotine affects various systems within our bodies. It affects the nervous system heavily, the cardiovascular system, as well as the respiratory system. So, when looking at the nervous system is highly affected by nicotine and includes side effects such as dizziness, sleep deprivation, changing the way our blood flows, as well as consistent headaches. Many people who indulge in nicotine claim that smoking it helps calm down their anxiety. However, rates of anxiety actually increase when the drug isn't active in their body. Within the cardiovascular system, when smoking nicotine, there are severe damages to our cardiovascular system. Effects include changes in heart rhythm and heart rates. It can also cause an increase in blood pressure as well as narrowing the arteries. This leads to the hardening of the arterial wall, which may lead to heart attacks as well as even a stroke. Smoking in general, but nicotine specifically, can cause inflammation in the airways and impair lung functions. The damage increases mucus production as well as damaging small organs that clear debris from our airways. Long term effects of this can lead to chronic illnesses such as lung cancer. Another fun fact, 67% of teens who smoke nicotine actually want to quit. Society influences on nicotine. So, although there are many people out there who want to stop smoking nicotine, they face troubles due to the influences of our society. So, rather than spreading awareness online and within our media, there's constant pro nicotine propaganda that spreads, such as songs, videos, memes, etc., that end up encouraging people to continue smoking nic, as well as introducing it to people who are just slightly curious about it. So, quitting nicotine and quitting smoking is one of the hardest things to do, but it's also the best thing that you could ever do for your overall personal health. Experiencing withdrawals are signs that your body is trying to and starting to recover. Withdrawal symptoms can include cravings, feeling restless, having trouble sleeping, concentrating, and having increased anxiety as well as weight gain. When quitting, the first week is always the hardest week, but many report that symptoms only last from 2 to 4 weeks. So, if you do smoke nicotine and you want some resources on how to quit, I have provided them as well as my references used in my presentation today. And thank you for listening.